Hi, my name is Lauren Dunn, and I'm submitting this video interview to communicate why I believe I'd be a great candidate for acceptance into Georgetown University's Family Nurse Practitioner program. I graduated from Michigan State University with my bachelor's in nursing in 2013, and since then I've been working as a registered nurse at the University of Michigan Health System in the cardiac step-down unit. In addition, I've taken on the role as unit falls liaison within my unit, and I've helped to pilot a fall prevention program. I also work for a free clinic for patients without insurance called the Hope Clinic, and I believe that all of these experiences have prepared me and inspired me to continue my education. I believe that what makes me a great candidate and has prepared me for this advanced practice role has been my diverse experience with populations across the lifespan from pediatric to geriatric and end of life. In my current role, I work with adolescents to end-of-life patients with cardiac issues such as congenital heart in the younger patients to complex comorbidities along with primary cardiac issues within the older populations. As an undergraduate student, I worked in a memory care unit in an assisted living facility where I was exposed to geriatric patients, and I also volunteered in the Child Life program within the pediatric units at DeVos Children's Hospital, where I was able to interact with pediatric patients, families, and providers. Within the Hope Clinic, I work with patients that are managing chronic diseases or newly diagnosed with chronic diseases such as hypertension, diabetes, and chronic kidney disease. I've really enjoyed working within the primary care environment, and that's why I've chosen to go into primary care as a family nurse practitioner. I've also worked alongside family nurse practitioners and other members of the healthcare team, which I believe has really prepared me and given me practical experience that will help me be successful as a student. I believe my career goals include to work as a primary care nurse practitioner within a nonprofit organization, hopefully working with underserved populations as I do now. In addition, I'd like to get my DNP, and I would like to be involved with nursing education at some point in my career. Right now, I mentor a nursing student on my unit, and she's in her senior year of nursing school, and I would like to continue to be involved with developing the future generation of nurses. I believe that Georgetown will be a great place for me to continue my education, as their mission statement aligns well with my personal values and faith. I really resonate with their emphasis of diversity, as I've experienced how important that is in providing excellent patient care within both inpatient and outpatient settings. And I appreciate that they pursue the glory of God and well-being of humankind in their education. That aligns well with my personal faith and values, and in addition, they believe in active participation and living generously in service to others. And those are values that I aspire to mirror in my own life, and I would aspire to mirror in my professional life as a family nurse practitioner. I believe that some of the challenges that I will encounter as a family nurse practitioner student will be time management and stress management, and I plan to combat these by utilizing time management skills that I was able to fine-tune during my undergrad when I attended school, planned a wedding, worked 3 jobs, and was actively involved in my church community and within student organizations. For stress management, I plan to focus on my health and well-being and rely on my current practices of exercise and eating healthy, and also to work part-time along with going to school part-time so that I can increase my availability to focus on my education as well as continue to grow professionally and gain valuable experience. I believe that a specific clinical situation that exemplifies my interpersonal skills and my compassion for patients would be a few months ago when a patient of mine had been there for over a year and was telling me about how every year him and his wife host a party in remembrance of a friend who had taken his own life, called a celebration of life party, where they invited all their friends over, friends of the friend who had passed away. And he was asking if there was any way he could go outside into the courtyard with his friends and have this party, since he wasn't able to host it at his house. So this patient unfortunately had many complications from a cardiac procedure, including acute dialysis, arrhythmias, and a stroke. And so it was considered high-risk transport. So I did call down to the high-risk transport team, talk to our charge nurse, and we were able to take one of our staff out of staffing for an hour and get this patient outside. And what it taught me as a nurse was that going above and beyond for a patient can really make a difference in their lives and their experience as a patient. And the family was really grateful. So personal experiences that have shaped my path towards a career in nurse practitioner started when I was a child, and I lost both of my grandparents to cancer, and I was determined to find the cure for cancer. But that desire has matured into really wanting to promote health and wellness within my patients and community. And in addition to that, my grandmother recently had a pacemaker put in, and her nurse practitioner was so patient and helpful with her and helped her to make an informed decision about whether or not she wanted to go through with it. Also, I've had nurse practitioners care for me and my health care, and all of them have inspired me to follow that path. So just make sure I've answered all the questions here. But yeah, my life has been full of nurse practitioners and patients that have inspired me, and I would love to have the opportunity to become a nurse practitioner myself. So thank you for your time, and I really look forward to your decision. Thank you so much.